The extraocular muscles attach to the globe of the eye and allow it movement in 9 positions of gaze as well as stabilization of the globe. There are 6 extraocular muscles located at the top, bottom, and sides are the rectus muscles, superior, inferior, medial, and lateral, and the obliques, superior at the top, inferior at the bottom. Notice where the oblique muscles attach to the globe, because if you understand where they attach and where they anchor, you can better understand how they assist in movement. Also notice up at the top there, that little loop that the superior oblique muscle is running up and through. That is called the trochlea of the superior oblique. That's a little notch of cartilage attached to the frontal bone. And the whole thing, the way that's set up, it acts as a pulley system. Positions of gaze. This is important to know when you're testing the eye muscles or when you're being tested on the eye muscles. There's one primary position of gaze with both eyes fixated straight ahead. There are 4 secondary positions of gaze, the horizontal and vertical positions, up, down, left, and right, and 4 tertiary positions of gaze, up and to the right, up and to the left, down and to the right, and down and to the left. And these positions have names attached. Looking up, circumversion, supraversion, elevation, or up gaze. Down, dorsumversion, infraversion, depression, or down gaze. And then you have left, levoversion, and right, dextroversion. Tertiary positions are easier to remember. They're simply up and right, up and left, down and right, and down and left. These make up 6 cardinal positions of gaze, 2 vertical positions of gaze, 1 primary position, 9 diagnostic positions of gaze. I'll talk a little bit more about why we differentiate these positions of gaze later on in the video. Let's talk about how the ocular muscles move the eyes into each of these fields of gaze. So we have the elevator and depressor muscles that cause our vertical movements of gaze, up gaze and down gaze. We have elevation, or circumversion, supraversion, up gaze, caused primarily by the superior rectus muscle, aided by the inferior oblique. Depression, dorsumversion, infraversion, or down gaze, primarily the work of the inferior rectus muscle, aided by the superior oblique muscles. Abductors and adductors, the horizontal movers. In this levoversion, the right eye is adducted, meaning it's pointing nasally. That is the work of the medial rectus muscle, aided by the superior rectus and inferior rectus muscles. The left eye is abducted, pulled temporally. That's the work of the lateral rectus muscles, aided by the oblique muscles, the superior and inferior obliques. Intortors and extortors. Intorsion is a movement by which the top of the eye rotates nasally. The primary mover for intorsion is the superior oblique muscle. The superior oblique is aided by the superior rectus muscle. Extorsion is a rotation of the top of the eye temporally. The primary mover for extorsion is the inferior oblique, and it's aided by the inferior rectus. It's pretty easy to remember which cranial nerves innervate which extraocular muscles because they're all innervated by cranial nerve 3, the ocular motor nerve, except the superior oblique muscles, which are innervated by cranial nerve 4, also called the trochlear nerve. And remember, the superior obliques run through that little notch of cartilage called the trochlea of the superior oblique, so it's easy to remember that one. And the lateral rectus muscles are innervated by cranial nerve 6, the abducens nerve, and the lateral rectus muscles are the abductors of the eye. Another way to remember, if you can remember SO4, LR6, the superior oblique muscles are innervated by cranial nerve 4, the lateral rectus by cranial nerve 6, and then just remember the rest by cranial nerve 3. Vergences, versions, and ductions. We'll begin with ductions. Duction is the movement of one eye rather than both eyes. We've already talked about abduction and adduction, the movement of one of those eyes. Let's go over some terms first. Agonist. The agonist muscle is the muscle that is primarily responsible for moving the globe of the eye into the certain position. The antagonist is the opposite of the agonist. As the agonist contracts to move the globe, the antagonist must relax to allow that movement. And the synergist just assists the agonist in the movement. For instance, when we talked about elevation, the primary mover there, the agonist, was the superior rectus muscle. The synergist muscle, the one that assists the superior rectus in that movement, is the inferior oblique muscle. That would be the synergist. And there's actually a law about this. Sherrington's law of reciprocal innervation, which states when an agonist muscle contracts, an equal and opposite innervation to relax is received by its antagonist. So let's watch some ductions. It'll help in remembering which muscles are responsible for which movements. Abduction, lateral rectus, aided by the superior oblique, inferior oblique. Adduction, medial rectus, aided by superior rectus and inferior rectus. Elevation, superior rectus, aided by inferior oblique. Depression, inferior rectus, aided by superior oblique. In and up, inferior oblique, after the eye is adducted by the medial rectus. Up and out, superior rectus, after the lateral rectus abducts. Down and out, inferior rectus, after the lateral rectus abducts. Down and in. This position is achieved by the superior oblique muscle after the medial rectus muscle has adducted the eye. I think of this as the reading a book position, so the superior oblique is responsible for this reading a book position of the eyes. Excycloduction or extorsion, inferior oblique aided by the inferior rectus. Incycloduction or intorsion, superior oblique aided by the superior rectus. Versions. Versions are parallel movements of both eyes, or both eyes moving in the same direction. Yoke muscles are pairs of muscles that pull the eyes into these parallel positions. There are 6 pairs of yoke muscles that correspond to the cardinal positions mentioned earlier. Another law, Herring's law of equal innervation. When an eye muscle contracts in one eye, equal innervation is received by its yoke muscle in the other eye. They move in parallel, in other words. We've already gone over the 6 cardinal positions of gaze, and these positions are important because each one of these 6 positions isolates one of the 6 extraocular muscles. This time, note the 6 pairs of yoke muscles responsible for each position of gaze. I'm not going to get into testing in this video, but I did want to mention that while there are 9 diagnostic positions of gaze, when you're testing the individual extraocular muscles for function, the most important positions are the 6 cardinal positions, because the vertical positions or midline positions, straight up and straight down from primary, may help determine the elevating and depressing capabilities of the eye, but they don't isolate any of the muscles. The 2 elevator muscles, superior rectus and inferior oblique, and the 2 depressor muscles, the inferior rectus and superior oblique, kind of compensate for one another, so neither one are isolated in those positions. when you test in the 6 cardinal positions of gaze, each one of the 6 extraocular muscles are isolated in one of those positions. Vergence. Vergence is the movement of the eyes in opposite directions in order to maintain fixation. I'll do an entire video on vergence and fusion, but for the purposes of this video, we'll just mention briefly convergence and divergence. With convergence, the eyes are moving in opposite directions towards one another to maintain fixation, such as when an object is coming closer. With divergence, the eyes are moving in opposite directions away from one another to maintain fixation, as when an object is receding. This is Owen, who wanted to help with this video. So, as he watches this pen, you can see his eyes converge. Muscle movements one last time, because this chart might be helpful. Of the 6 extraocular muscles, the medial rectus and the lateral rectus each only have one job to do. The remaining 4 muscles have 3 jobs. They're primary, they're secondary, and they're tertiary. The medial rectus adducts the eye, turns it nasally. It's the primary and only responsibility of the medial rectus muscle. It's aided by the superior rectus and inferior rectus. The lateral rectus abducts the eye, turns it temporally. It's its primary and only responsibility as far as movement is concerned. It is assisted by the superior oblique and inferior oblique. The superior rectus is responsible for elevation, aided by the inferior oblique. Inferior rectus is responsible for depression, aided by the superior oblique. The superior oblique intorts the eye, aided by the superior rectus muscle. The inferior oblique extorts the eye, aided by the inferior rectus. Some mnemonics to help remember: SINRAD, meaning superiors intort, recti adduct. And another one I heard, I'm not sure how helpful this is, but I figured I'd mention it. Superiors do not extort, and obliques move eye out.